Peptest is used in my clinic on a weekly basis. Whenever the patients come in, they have a pep test beforehand, and I see particularly people with cough, and in the diagnosis of cough, the main diagnosis that I see is the non-acid reflux, and Peptest is the only appropriate test that we do, which gives us an objective measure of their cause of their cough. We use Peptest on every clinic that I do. I study patients with cough, and non-acid reflux is the commonest cause of a chronic cough. Peptest is the only test which is available which diagnoses this in an objective fashion. And so every patient, when they come to the clinic, has had 3 samples taken at the time of symptoms to provide us with the objective assessment of the cause of their cough. I've had quite a bit of feedback on the patient's response. They find the test very easy to do. They appreciate the idea of doing it at the time of symptoms so that they're able to pick up the pepsin in the saliva. We've had no complaints. Often they're surprised that they actually have the pepsin detectable in their saliva, because they've been told repeatedly that there is no test that can be used. And so when they have a positive result, and I can show them objectively in the clinic a positive sample, they're greatly relieved actually, rather than have any problems with it. We use Peptest for a wide variety of different complaints. Patients with voice disorders frequently come along to my clinic, and they again have been misdiagnosed as having acid reflux as the main cause of their voice disorders. This reflux is a gas which can go widely throughout the upper airways into the ears, for example, and so they often have symptoms of their ears and their nose as well as their voice. So coughing is merely part of a spectrum of symptoms that the patient complains of. Often the doctor finds them mysterious, and frequently, because they can find no explanation, they think that there is something psychologically wrong with the patient. So it's the patient's fault, which is not true. The PEP test's great advantage here is it gives us an objective measure to show that there is something wrong, rather than it's the patient's imagination. To me, PEP test has been a very useful adjunct to my clinical practice. I find that the reassurance that it gives the patients that they have an objective demonstration of the disease I'm talking about, because they have seen many other practitioners who've told them that they do or do not have reflux, that it is or is not acid, but to have this objective demonstration that I can show the patient in front of them that the test result is positive gives them an enormous amount of reassurance that I'm not talking nonsense.